There is a huge possibility that the COVID-19 pandemic could not only result in a humanitarian crisis, but also an economic disaster. UWI Dean of the Faculty of Medical Sciences, Professor Terence Seemungal, who was a guest on TTT's Now Morning show on Tuesday, described what a spiraling rise in the virus cases can produce.
There's not only the acute phase where you're in hospital using up services, but there's going to be a phase after that. And that's what we have to remember. So there's a huge cost to the health of the economy.
Yeah.
One also has to remember the effect on the economy of having huge numbers of people in hospital. That is a huge drain on the economy.
Professor Seemungal said to avoid this possible spiraling of the virus, the population needs to get inoculated.
People who have underlying conditions of cardiac disease, hypertension, diabetes, etc., the so-called NCDs, are at great risk of having complications from COVID. These are the people who die, obesity, these are the people who die from COVID, have to go to the intensive care unit, have prolonged morbidity. So these are the people who need to definitely get vaccinated.
Professor Seemungal was optimistic, however, that this country and the rest of the developing world could access sufficient vaccines to achieve herd immunity within the next 12 to 24 months.
What I must say, what I found encouraging was a recent meeting that I attended with the Caribbean, Central American, and Latin American countries, in which I saw that vaccines are actually being developed in Argentina, Brazil, Mexico, and of course there's the Cuban vaccine that's gone a long way.
Professor Seemungal said estimates are that within 1 million, only 4 or 5 persons could have blood clots, and this side effect is easily mitigated with treatment by medical staff. Browne-Campbell, TTT News.